submandibular ganglion or Langley's ganglion. In this topic, we will be discussing the location, relations, roots, and branches. The submandibular ganglion is a parasympathetic ganglion which serves as a relay station for secretomotor fibers supplying the submandibular and sublingual salivary glands. Topographically, it is connected to the trigeminal nerve, but functionally it is related to the facial nerve through its chorda tympani branch. Location. This ganglion is the size of a pinhead and situated on the outer surface of the hyoglossus muscle. It is suspended from lingual nerve by two twigs. The proximal twig is efferent to the ganglion and distal twig is efferent to the ganglion. Relations. The relation above is the lingual nerve. Below is the deep part of the submandibular gland. Medial is the hyoglossus muscle. Lateral is the submandibular gland, the superficial part. Roots. The submandibular ganglion has three roots: parasympathetic, sympathetic, and sensory. Parasympathetic root. It is derived from the lingual nerve. The preganglionic fibers arise from superior salivatory nucleus situated in pons and pass successively through the facial nerve, chorda tympani, and lingual nerves to reach the ganglion where they relay. The postganglionic fibers arise from ganglion and directly supply the gland. Sympathetic root. It is derived from sympathetic plexus around the facial artery. The preganglionic fibers arise from the first thoracic spinal segment, T1, and enter the cervical sympathetic chain to relay in superior ganglion. The postganglionic fibers arise from the superior cervical sympathetic ganglion and form plexus around the facial artery to pass through the ganglion without relay and supply the blood vessels in the submandibular and sublingual salivary glands. Sensory root. It is derived from the lingual nerve. Branches. The branches of the submandibular ganglion are 5 to 6 branches which supply the submandibular gland. Other fibers join the lingual nerve to supply the sublingual and anterior lingual glands.